The Laura Municipal Hospital is in dire need of medical equipment. The hospital, which was established some 90 years ago, now has its structures jarred and dilapidated, and medical equipment are inadequate, forcing them to refer cases outside the facility. The hospital has no neonatal intensive care units and has one incubator for several premature babies born at the hospital. The medical ward hospital of the facility is admitting both males and females, and they both share one bathroom and toilets. So here's more from Rafik Salam on the 90-year-old hospital.
Established some 90 years ago, the Laura Hospital's sole duty was to address the issues of preventable diseases which were prevalent during the colonial era. The first medical doctor posted to the area was Dr. Smith. Paramount Chief of the Laura traditional area, Napo Wele Cabo III, who was born 21 years after the hospital was established, says the hospital changed its focus to curative diseases 10 years after its establishment.
By extrapolation, we believe that the early hospital, the focus was more on prevention than the curative aspects, because at that time, the whole of the Northwest, and indeed the whole North, was devastated by preventable diseases like sleeping sickness, dysentery, malaria, and others, mumps, yaws. And so it was a good idea to focus on this aspect of prevention. That is, and therefore, their major focus at that time to educate our people and try to see how they can eliminate these devastating diseases.
Close to 40 years ago, Zeka Iriele took over the reins of the administration of the hospital, coupled with his duties as a medical assistant. He tells me how life was when he took charge of the hospital in 1978.
Challenges were water and light. I had to, from our own resources, connect the hospital with water, and also pressured the water supply department to help supply the hospital with water to make it functional. Else we were using service water to wash our hands to provide services.
The situation at the hospital, however, has changed today. It is now a 110-bed hospital with a little over 250 staff, serving a projected population of 64,000. The hospital is the main referral point for 4 health centers, 1 polyclinic, and 18 CHIPS compounds. Yet, the equipment to do the work are either obsolete or not adequate. Dr. Justin Dakura is the medical superintendent of the hospital.
If we are to have about 5 cesarean sections in a day, the equipment that we need are not really adequate. If we have in succession about 5, that means that we have to re-sterilize, use, pack, sterilize, use. So we don't have enough of the equipment that we need for maternal care and then some of the other major operations that we can easily carry out here. So because of that, some of the cases have to actually be referred.
This small room I am currently in is supposed to serve as the neonatal intensive care unit of the hospital, because I'm told that they don't have it. And so, but they are supposed to take care of premature babies and other babies that are born and they are not well. But just closer to me, you can see that there's an incubator, and this incubator takes care of 1 or 2, but they have some challenges. Doris B. Negre is Laura Municipal Health Director, Public Health Nurse.
When we have just 1 incubator, definitely there's going to be cross-infection, because the babies are not coming from the same family. They are coming from different families, and they may have other disease conditions. So because of that, putting them together in 1 incubator is actually not always very helpful at all. And even they need to have a very spacious place where they can have a lot of fresh air with their mothers in there, it is difficult because at this time, like these children, they are very fragile and they need a lot of care. They need cleanliness. They need to have a lot of personal hygiene so that the whole place will be sterile to be able to take care of such children. This year, like that, we have got about 5 neonates dying. Last year, there were 9. But at least with the efforts that we have put, even though it's not enough, it has been reduced at least to 3, 2016. But this year again, last year, 2017, it went up again to 5.
This is the medical records department of the hospital. This is where folders of patients are kept. At my back, you can see huge files packed on the shelves. Administrator of the hospital, Prosper M. Lana, tells me the inconveniences they go through to search for folders to patients.
The place is quite small, and over the years it's getting filled up, and the challenge now is where to store them. So usually the staff in this particular department have issues with retrieval of folders, timely retrieval of folders. There are instances where folders get missing and all of that. So the way out for now is for us to go electronic. So when we have a computerized or a networked system where patient details are on a computer and they are able to be attended to quickly, it will really help improve our efficiency in service delivery.
Another major concern for the hospital is the jaded and dilapidated structures inherited from the colonial administration. The general ward, now christened medical ward, since its construction 90 years ago, has seen little renovation. Deputy Director of Nursing at the hospital, Roberta Yuribayo, said, apart from the dilapidated structure, the roof leaks.
The ward is so dilapidated. The ward is, even patients have outgrown the ward, and so there is so much congestion in the ward, and the ward is leaking, all the ceilings are leaking, and we need help to rehabilitate, major rehabilitation of the ward.
The ward is also for both males and females, and both sexes use one bathroom and toilet. She appealed to the government and other benevolent organizations to come to their aid.
Right now, they have all share the same bathhouse, and it is difficult for female and male to share a bathhouse in the ward. And so we are thinking that we know the ideal is to have a separate ward, medical ward for females and a separate medical ward for males. But for now, we don't have the capacity to build a separate medical ward for males and a separate medical ward for females.
The issue of security and flooding at the hospital can also not be overlooked. The hospital is not fenced, giving opportunity to visitors and animals to enter at will.
So we think that the presence of a fence wall would actually help eliminate all of these inconveniences, because there will be a central entry point where there will be proper regulation of who enters the hospital, and the animals will not have that opportunity to get into the hospital.
Municipal Chief Executive for Laura, Martin Domatire Bombeire, says he will go all out to ensure the challenges are resolved.
As a municipal assembly, we know that health is very paramount for development, and we want to ensure that the necessary infrastructure, logistics are available in that facility to ensure that people get the needed healthcare services that they need. Because we believe that when people are healthy, then our economic development can go on.
After 90 years of good service to the people of Laura and its environs, workers and residents expect the government turns the fortunes of the hospital around for the better. Reporting for JoyNews, Rafik Salam, Laura.